Please go ahead.
Please unmute.
Live.
Good afternoon, Namaskar, and Jai Hind. Welcome to all of you for joining us in this another edition of our webinars titled Illness to Wellness. And today the topic is non-communicable diseases, the new health challenges for West Bengal. So I'll just give you a small introduction of these webinars. Illness to Wellness is a series of webinars which we've been doing since past 2 years, even though this is a series of programs through which we have been creating health awareness, and especially about non-communicable disease in societies, in communities, since more than past 5 years. And I would like to inform you that we have physically consulted and screened more than 13,000 people in the 3 years before the pandemic of COVID. And since the pandemic, we have switched over to the digital mode, and we are creating awareness about health, about diseases, especially chronic diseases, non-communicable disease among the society. And we are inviting star guests, specialists who give advice to our listeners about what is best for them regarding prevention and being healthy. So once again, I'd like to welcome all of you to this forum. And today's topic, as you have seen, is something very special. And it is special because obviously we all want to have a good life, but disease comes in way of our life, and the diseases which have become key causes of death today are not the ones which used to happen earlier. Those were the infectious diseases like diarrhea, tuberculosis, but things have changed a lot now. What we are facing today is another pandemic, the pandemic of lifestyle diseases. As I remember in one of our programs, Dr. Bhishmarayan Singh, he was a veteran politician and a freedom fighter, said that the key to life, to a good, healthy, and a happy life is ahar, vyavhar, and vyayam. We have been somehow forgetting this, and what has happened is resulting that the non-communicable diseases, which are majorly the cardiovascular diseases, the chronic respiratory diseases, the cancer and diabetes, they are now contributing to almost 82% of the non-communicable diseases and deaths. And almost 60% of all the deaths all over the world are caused due to non-communicable disease. So here's the time to realize and to fight against these diseases. And for that, today we have with us, I would say, stalwarts, galaxy of specialists who are going to guide us, who are going to answer our questions about how to be healthy and how to avoid these diseases. We have with us Dr. Kunal Sarkar. He is a Senior Vice Chairman and Senior Consultant Cardiac Surgeon in Medica Super Specialty Hospital, Kolkata. We also have with us Dr. Sanjoy Mandal. He is a Senior Consultant GI Surgeon specializing in oncosurgery and advanced laparoscopy at AMRI Hospital, Kolkata. We have with us Dr. Sunil Kumar Daksh. He is a consultant nephrologist at Narayana Group of Hospitals, Mukundpur, NSH, Howrah. And Dr. Avdesh Kumar Singh, famous endocrinologist, was supposed to be with us, but due to some accident, he could not be present. And we also have with us Mr. Kaushik Datta. He's the founder and co-director of Thought Arbitrage Research Institute, New Delhi. He's going to enlighten us about a research which was conducted by ASSOCHAM, the organizers of this Illness to Wellness series and today's program, in which more than 2 lakh people have participated. So it was a nationwide survey, and it was conducted in more than 20 states, and it studied the prevalence and the reasons and the causes of non-communicable diseases all over the country. So I would hereby request Mr. Datta to give a small cap uh, of what he has found about West Bengal, because today we are giving special focus on West Bengal, and we are specialists, especially from West Bengal, about this. Mr. Datta.
Will someone give me access to sharing? Yep, thank you. Good afternoon. It's a pleasure and an honor to be speaking to all of you, and especially in the festival season. My best wishes to everyone who's attending this program. NCDs, like Dr. Kesri was saying, is one of the biggest killers that we have.
Sir, please increase your volume, sir.
Yeah.
Speak a bit loudly, Kaushikji.
Please, sir.
Okay,
Or come close to the microphone.
Just a second. Hello, is it better? Globally, roughly about 3 out of 4 people who die because of NCDs. And in India, it is one of those diseases which have moved from, in the 1990s, about 40% of Indian population was dying of NCDs. In 2019, it's moved up to nearly 65%, which makes it the biggest killer. And also, if you look at it, the disability adjusted life years, which is basically the cost of having this disease, the life cost of that in India is roughly about 271 million in days or years, which is roughly about 58% of the total shares of NCDs that people actually, and the total life years that we get that are lost. The other point in this slide that's a takeaway is that the total economic cost is a loss of $3.55 trillion for all 4 NCDs in India. Just 4 NCDs cost India $3.55 trillion, which is fairly large. And to put it into context, about 3 trillion is your total stock market capitalization. So we lose about the same amount because of deaths due to NCD. So what this slide says is that it is how one NCD is connected to the others. If you look at, there are 2 NCDs which have got the highest amount of comorbidity. That means if you have one of these NCDs, one of these non-communicable diseases, how it affects other non-communicable diseases. And the highest among that is diabetes, which has got a very high correlation with cancer, heart diseases, respiratory diseases, hypertension, neurological disorders, kidney, digestive diseases, and so does hypertension. These 2 have the highest correlation among all NCDs, and that means that the comorbidity of this has got the highest index. Now, if you look at West Bengal, what do we see? This study, like Dr. Kesri said, was done with 233,000 people all over India in 21 states, included about 615 public primary health centers and hospitals. So it's got a fairly large sample to come up with our conclusions. So if you look at the prevalence of NCDs in West Bengal, digestive diseases, kidney, neurological disorders, hypertension, all NCDs, West Bengal unfortunately has got a higher prevalence than the national average. And in some of them, in digestive diseases, in neurological, in hypertension, it's respiratory, it's significant, and it's significantly high, including diabetes. And see, that's one of the things that actually come out of the survey. And and which will be the matter of discussion for all the panelists and experts later today. And if you look at what contributes to NCDs, a lot of these, I mean, there will be conversations on lifestyle, food, and other habits. West Bengal population, by and large, has got much higher stress levels than the national average. So there's a high level of stress. At the same time, the sleeping hours, which is the calming or the other side of stress, means things that de-stress you. The sleeping hours in India are just as high as the national averages, but the stress levels are much higher. So that would have a correlation to higher NCDs. The second thing is that in West Bengal, there is a much higher level of physical activity or exercise carried out than the national average. But having said that, the body weight there is a larger number of people who are underweight than the national average, which could also mean that there is a dietary problem and the fact that there could be some amount of unbalanced diet and malnourishment. Air pollution in West Bengal is sparse, so this is a cause for the respiratory disease. But there are also some reports which have come out later, which puts Calcutta as a city which has got one of the highest level of air pollution in India. So even though in West Bengal it might be the pollution level might be lower, but in Calcutta certainly it's inching towards much higher risk. Dietary habits. It's not surprising that West Bengal has got much higher than a non-vegetarian food consumption, which is meat, fish, or basically red meat, chicken, fish. So it's significantly higher than the national average. West Bengal has got higher level of vegetable consumption than the national average. But at the same time, the fruits, which balances with the vegetables, the fruit consumption is actually lower. The legume, which is dal and pulses, we consume in West Bengal just as high as the national average. But at the same time, protein through milk is much lower. Junk food, street food, which has got fairly high salt content and carbonated drinks, we consume it just as much as the rest of India, and that actually has got a direct effect on lifestyle, obesity, and other measures that the esteemed panelists will later talk about. These slides are actually quite important because we have done this study for so many other states, and we have done this webinar for a number of states. But in West Bengal, the treatment-seeking behavior is quite different from other parts of the country, and including the national averages. The first one is that 61% of people in West Bengal do not take periodic health checkups, as compared to the number of a national average of 47. That means we in West Bengal delay our treatment than the rest of the country. The other one is that 31% of people in West Bengal seek medical advice only when it actually becomes pervasive, or it becomes at significantly higher stages of symptoms or the disease, or due to medical compulsions. That means the body has just given up, as compared to 17% at the national levels. So this is where it's nearly double as much as people delay prevention. The other thing is that when you look at the household income, West Bengal household income at the lower levels is 69% of the people are below 10,000. That's in the sample that we have taken. It's not necessarily for entire West Bengal, which means that your ability to pay for medical expenses is that much limited. So this could be a reason why people do not seek medical treatment early enough, or for prevention. The other thing is that out-of-pocket expenditure in West Bengal is just as high as is lower than the national average because of two things. Surprisingly, there are more people who are covered by insurance policies or government health schemes. And there is also a large number of people who seek free treatment through charitable trust societies and other non-governmental organizations. The out here is that 78% of the respondents in our sample, the cost of their medical treatment was below 10,000. So that means, as if you look at the percentage of income, and we said that large number of people are within the 10,000 bracket, significant, if you fall sick, significant part of your income just goes away in paying medical bills. And that needs healthcare intervention, that needs infrastructure changes, that means government insurance and everything else to kick in. Otherwise, this creates a debt and a poverty trap for poorer people. So to put it as in a summary, that we do have a much higher prevalence of Ncds in West Bengal. We have higher stress level in West Bengal, but we have good sleep. We consume fairly large amount of non-vegetarian food, which is not surprising at all. And diseases related to high consumption can be expected. We consume reasonable, good, quantities of vegetable, but not enough fruits. We consume enough legume, but not enough milk. We consume as much as carbonated drinks and junk food or street food. We do have higher level of intoxication, which includes alcohol, which includes chewing tobacco, other forms of tobacco, than the national average. And we do not take, like I said, we do not take enough, we do not take preventive health checkups. We have, and the income level also may be preventing people from taking early health checkups. So these are the conclusions from the report which pertain to West Bengal. And if you have any questions on the sample or on our presentation, we would be very happy to answer them. Otherwise, over to you, Dr. Kesri.
Thank you so much, Kaushikji. That was, I would say, quite enlightening, and some of the key points that you have mentioned, that West Bengal has a higher rate of NCDs, and that is particularly quite high because almost 18% as compared to 11% pan India is. So that indicates quite a significant difference. I would like to request our panelists if you would like to ask any particular question to Mr. Kaushik ji, you're most welcome. Otherwise, we'll move on ahead with our discussion. Okay, so I'd like to come to Dr. Kunal Sarkar, sir. He is a cardiologist, and as we are seeing that majority of the burden of NCD is associated with heart disease. So first of all, give us a small introduction, say a few words about non-communicable disease and the place of cardiac disease in that as such.
Thank you, Mr. Kesri. And that was a wonderful presentation. And I really was making notes of lots of very valuable information we learned from the last presentation. So if you want to understand non-communicable diseases, you basically have to understand human evolution. And if you talk about human evolution, please understand one thing, that, like the cat, the mouse, the donkey, the dinosaur who's no more, human beings, the human physiology was created, the so-called modern human being, defined today, was created about 120,000 years ago. And all this civilization and progress that we boast about today goes back only less than 10,000 years. So for 150,000 years, we had no idea who we were, what we did, what diseases we came with. But originally, the most important idea that the human biological machinery, with its cardiological digestive, reproductive, locomotor, muscle system was not really made with the modern human being in mind. It was made with the hunter-gatherer in mind, that this fellow who's able to stand up straight, who's able to grasp things, who's got an oversized brain in his body, is enabled with color vision, can see through his eyes, will really be living on as much food he really needs to eat, will not fall to taste, will be walking for God knows how many miles every day, and even agriculture. What do we eat today? You eat rice, wheat, etc. Where did they come from? They came from agriculture. So agriculture only came 7,000 years ago. So for 120,000 years, your and my machinery was made. All this business about rice, cornflakes, dal, chapati, and everything only came 5,000 to 6,000 years ago. So what we eat is everything you eat basically today is foreign to the body as far as the original manufacturing of the human physiology is concerned. So understand that. And since we were neither manufactured by Apple or Samsung, you don't have regular hardware, software updates. So I think God is taking a rest, because after the 11 days of creation, God has been keeping very busy. So he has not had any. So we have the same pancreas, the same stomach, the same small intestine. And somewhere down the line, you see, nature made a lot of mistakes. And the first mistake was that human beings really, and one or two mammals before us, were the only beings. Sometimes you can aspire to do big things, be very ambitious. Some of these ambitions work and some of these ambitions turn out to be mistakes. So one of nature's ambitions for human beings was, why do we get so much heart disease? Because we are the only mammals where hearts are supplied by arteries. So if you look at a bird, a snake, an alligator, none of these people have any arteries in their heart. Their heart is like a sponge. Blood comes inside the heart. The blood gets soaked inside the heart muscles. And that is how the heart works. And they are very efficient hearts. They can, they're as powerful as ours. But nature, probably in discussion with Tim Cook of Apple or something, had an idea that I have to bring up human beings 12.0, or, software upgrade was given to us. So whereby what happened is, the nature gave us small arteries to supply the rest of the body, the entire body, especially the heart. And that was a big mistake. But nature was not aware that samosas will come, ghee will come, McDonald's will come, ITC will be a famous company down the line of civilization. You see, nature was really ignorant, God did not see Yogi Deveshwar coming down the line. If he did, God would have completely changed the design of the human being. So with all these modern things happening, first of all, our basic diet, when I hear dietitians advise people, I listen to them with a lot of awe, because they're not telling people that the best diet is a foreign diet as far as the human physiology is concerned. Secondly is, we have to live with nature's mistakes, that nature has given so many fine blood vessels throughout the body that at drop of a hat, they get blocked. What is diabetes? Please remember, diabetes is not a disease of sugar. Diabetes is a disease of blood vessels. Like your indicator of a petrol tank, diabetes is just a needle indicator. Sugar is just a needle indicator with which diabetes is measured. And just to prove how ignorant we are, it has been about 150 years since we've recognized that blood sugar can increase and cause a lot of problems. But 150 years down the line, we still don't know what diabetes is. It's a little bit like Indian politics. In Indian politics, what happens? You cannot cure it, you can control it. So diabetes is like the Indian politician. We can control it, but since we don't know what causes the misbehavior, we still cannot cure it. So with lifestyle diseases, that is a basic problem for us to appreciate, that we are paying a penalty for our creators' laziness and our creators' inability to go on upgrading our biological software and hardware as we go on existing. So those of you who are in the bad habit of reading books, I've just written a book during the first lockdown called The Sickness of Health. So you can pick up a copy. All you are discussing today, the entire journey of Indian healthcare is summarized in that. So look, lifestyle diseases will be there to stay. I think that what the last pandemic has done to us basically is that within a few months we will realize that this kind of compartments in which we exist today, which is lifestyle diseases, one compartment, and communicable diseases, one compartment, this will really blur. The distinction will really blur. As we saw since 2019 in very posh hospitals, I work in one of them, we were really struggling to cope with a simple fever, respiratory infection, because our infrastructure was not made for that. But we think that the current pandemic is probably on the way down till the Wuhan lab decides to open the door of that refrigerator once again. And once the Wuhan lab opens the door of the refrigerator again, and our Chinese president wants to release some more samples into the atmosphere, till such time you can perhaps have a little bit of a breather. So I think the world will now learn to coexist between communicable diseases and lifestyle diseases. So we had the luxury of treating heart cancer, etc., for God knows how many, last 100 years, ever since the Industrial Revolution. So when did the Industrial Revolution start? Nobody knows the date, but probably 1830, 1835, that kind of a time. So ever since the Industrial Revolution, when we used machines to do our work, when a lot of, the world wars ended, and people were not using oil to oil the guns. Rather, Americans started putting oil into the burgers instead of the machine guns. So the dietary problem got much worse. So I think, as we have alluded to, especially in the section when my previous speaker gave very detailed statistics from West Bengal. Regarding West Bengal, since West Bengal is mentioned in the title of your webinar today, remember a couple of things. We are the state which has the most, our population density is about 3 times Maharashtra's population density. There isn't a single state of India which comes to within 30% of India's West Bengal's population density. We are crammed like a can of sardines over here. And we are the only state which, thanks to the ineptitude of our founding fathers, who had 4 waves of refugees coming into the state. That's a different subject. So population density is a big problem for West Bengal. Second problem is our variation in our ethno-demographic group, from religious minorities to tribals. It is the only state which starts with hills in the north and ends with Sundarbans and the tiger in the south. So from a mangrove forest to Kanchenjunga, everything is within the state. So it's a lot of different people, very tightly packed. And it is this biodiversity which is good in one way and very difficult to manage in the other. Healthcare infrastructure in West Bengal. Please remember that West Bengal is the only major state of India where 50% of the entire healthcare infrastructure capacity lies with the government sector. Right? It's about 54%. So we are the only major state of the entire country where the government sector has more infrastructural capacity than the private sector. Every other major state of India, the government sector is only half the size of private sector. In West Bengal, it is the reverse. And in general, when we talk about preventive medicine in India, preventive medicine in India is not yet been born. The person is still being conceived. You look at National Health Mission. We've launched Ayushman Bharat in a little chaotic kind of way. But the outlying clinics of Ayushman Bharat has not started as of yet. And if you get run over by a train in India, you will get your DNA checked. But till you are alive, there is no government program to check your hemoglobin or sugar. You have to have the disease first. In India, diseases get detected. And starting from the birth of a child, the regular periodic, that every 5 to 10 years, you are going to have a set protocol of some kind of health vigilance. That has not yet started, but I think, we are a relatively young country. We are a relatively growing country, and we have gone through almost 200 years of colonial deprivation. Why are we in this state today? Because all of you know the statistics. From a country that controlled 25% of world's GDP, we came down to 2% of world's GDP. So that was the amount of wealth that was sucked out of our country. And we were really made a very overpopulated concentration camp of beggars. And that socioeconomic deprivation, that post-colonial socioeconomic deprivation, is what we are struggling to counter today. But having said all that, I'll just end by saying that whenever you discuss, we doctors have forever tons and tons of criticisms. Yes, India does not have a healthcare policy. We are totally ambiguous about what our healthcare policy is. We are constructing a building, 5 floors are United States and the other 5 floors are Cuba. So we don't even know which way we are going. How much is in the private sector? How much will be in the sector? We are in a sense of drift. We are in a sense of anesthesia. We have a right to life. We do not have a right to health. But I think health is now becoming important in the socioeconomic sense and in the political sense. So as the country moves along, there will be a conscious need for the country to define a definite healthcare policy. And on that will rest the future of Indian healthcare, both therapeutic and preventive. But in the middle of all these problems, when I end, I'll just leave you with one statistics, which I think is the most important statistics of Indian healthcare. And that is in 1947, when the country became independent. The average Indian had a lifespan of less than 45 years. So today, 74 years after freedom, our country is almost reaching 70 years in average life expectancy. So look, all the effort that the industry, the doctors, the medical infrastructure, there are lots of defects, there are lots of problems. We can discuss the problems 1 week non-stop. But through all the problems, the effort of the common man, the effort of every healthcare worker has not gone in vain. In 7 decades of freedom, we have increased our life expectancy from 45 years to about 70 years. And that is a huge achievement. We have a long way to go. West Bengal has its own problems. And it's some of the problems, as I mentioned, I think West Bengal's first problem comes from its demography, from its population concentration, from its great biodiversity in its nature of people, which essentially means that our challenges is a little bit more difficult. But I think whatever we've achieved in 70 years, when we did not have policy, when only 1% of our GDP was spent on healthcare, I think with resources and planning, the future is bound to improve. Thank you very much.
Thank you so much, Dr. Kar. First of all, it was a very interesting take on the evolution of human beings and evolution of diseases, and especially the non-communicable diseases, and the way you have put forward the thrifty gene hypothesis was very, very interesting. So thank you so much. It was really very enlightening, and you have given a very deep insight on the health issues, the public health issues being faced in our country, and especially in West Bengal. Thank you once again. I'll come back to a bit later. Now, taking over the baton from here, I'd like to come to Dr. Sanjay Mandal. Sir, as Dr. Sarkar has pointed about the manufacturer, it is said that liver is the seat of all the diseases. And some people are of the opinion that even diabetes, keeping in view the twin hypothesis, and it is the fat in the liver which is driving all these non-communicable diseases. What is your opinion on this? And please tell us in few words about non-communicable disease as such. Your take.
Right. I'm audible, right?
Right, right. Yes, everything is perfect.
Yeah. Now, I think the fat which you talk about, the liver, the seat of diseases, yes, liver is an important organ. Uh, it detoxifies the body, manufactures a lot of things. It's an important organ, but it is not. I wouldn't agree that it is the source of all problems in the body. Uh, the cause is multifactorial. It's not just one organ, but yes, liver is definitely one problem. And the fat or the fatty liver, which we talk about, is very prevalent. Now, like Dr. Sarkar said, that we were hunter gatherers before. We would walk 10 kilometers and gather food and we would eat. The lifestyle which we are now leading is not what we were supposed to do. We were not supposed to get up in the morning, get our food, then sit in front of the computer, then have a big Coke and eat all the processed food. And you hardly see any playgrounds in the school. Children are not going, not doing their regular exercises. So this was not the lifestyle which we were programmed to do. So what has happened is that fat gets into a lot of organs of the body. It gets into the subcutaneous tissue. It gets into the liver also. It deposits in the liver. And normally, if you go through the whole population, everybody has fatty liver these days. It generally does not cause a problem in most people, but yes, with increased accumulation, it definitely can lead to problems, especially like NASH, and can lead to cirrhosis in the long term in patients, especially in certain group of populations, especially those who are more prone to taking alcohol or having a bad lifestyle. And obviously, when you have cirrhosis and liver related issues, you have, this is one of the other non-communicable diseases. And you have definitely you have lifestyle related problems and problems coming on. And it's a cause of death and morbidity in life. So definitely it is a problem and it needs to be taken care of. And we need to change our lifestyle and our thinking for this. Yes.
Thank you. Thank you so much. Thank you so much. And I'd like to come to Dr. Sunil. Dr. Sunil, sir, please throw some light on the non-communicable disease from your point of view of nephrology. I'd like you to, I request you to elaborate whether kidney disease as such by themselves are a major cause of NCDs, or it is the outcome of other NCDs which actually, as a result of the end organ damage, play havoc on the kidneys.
Okay. Already Dr. Kunal Sarkar and Dr. Sanjay Mandal, they have given a very good bird eye view of human and healthcare evolution. I will just explain about the kidney part of it.
Yes.
See, there are various parts of your question. One is like kidney is initially affected, or is the last organ to be affected? It is out of other primary illnesses, or it is the first organ to be affected? So to make it easy for a layman to understand, just think of kidney as a basically filter or as a drain pipe of your house. So in case it is blocked, so whole house will be filled with dirty water, sort of like this. So what is happening here is, in case the kidney is affected, we see symptoms at the last. We'll see symptoms of kidney disease like nausea, vomiting, decreased appetite, and itching, decreased energy to do daily course of their work. So kidney disease are primarily, kidney is basically affected primarily by long-term chronic illnesses like diabetes, hypertension. Majority of the kidneys are affected by these only. So in case our population has diabetes and hypertension, 60 to 70% of the kidney disease can be explained just because of these two. Remaining of the kidney disease, these are, we do see one out of old age with gradually increasing age with senility, the cells die. Similarly, in the kidney, number of cells which are known as nephrons, their number decreases. So with the decreasing numbers of activity or decreasing number of active cells in the kidney, overall kidney function declines. Other common cause is the on the table over the counter drug which are available like painkillers. Commonly, people will find on the counter medication in India, and they are again cause of kidney disease. Another important factor of which leads to kidney disease is pregnancy related, which is common in females and which requires a special mention that females who are pregnant, they are also at risk of kidney disease. That is why most of the females, when they visit their gynecologist, they will check for kidney disease. Apart from this, there is a triad of stone. We have this Afghanistan, Pakistan, India, and Bangladesh. Renal stone disease are very common. They also leads to kidney disease. So basically, in a way, we can say that kidney is primarily affected by other chronic illnesses. And there are some diseases in which kidney is primarily is first organ to be affected, and thereafter other organs will be damaged. So in a way, if we take care of other non-communicable illnesses like diabetes, hypertension, diet, exercise, all these things, most of the kidney work is done.
Thank you. Thank you. Okay. I'd just like to just clarify one thing here. Is it possible, because the kidney stone disease is very, very common, as you yourself mentioned in our country. Can it lead to oncology or cancers also if it is there for a long time?
In cancer in itself is a big chunk, and there's a renal cell cancer, multiple type of renal cancers which are there, but association with the stone is not cause effect relationship has been established. Just the way we were discussing one study just before we started talking. This is observation study. Observation means there are two things are going on. We cannot say one is the cause, another is the effect. Just like that, when we all grow during our adolescent age, we develop pimples on our face, right? And during adolescent age, we also tend to eat chocolates. We can't say that chocolate leads to the pimples. In a similar fashion, we do find stones and cancers. So cause and effect relationship has not been established. So sometimes both diagnosis can be there, but we can't say stone leads to cancer.
Thank you so much. That was very enlightening. Thank you so much for your point of view. I'd like to come back to Dr. Kunal Sarkar, sir. Sir, while I was getting ready for this webinar, I was thinking that actually the cardiovascular disease burden in West Bengal might be a bit less, and the NCDs as such might also be less because as far as I know, the majority of food that the Bengalis prefer is fish. And we all know that fish is very good, especially for cardiovascular disease, and it confers a lot of benefit. So what is your opinion on this, that we see in our numbers markedly increase non-communicable disease? And is that because of cardiovascular disease burden, or is it due to some other reason? And do you agree with this or not, sir?
Did you ask me, Mr. Keshi?
Yes, sir. Yes, I
was a bit tuned off for a minute. Yes.
Okay, so I'll ask you once again.
No, I got the question. It is like straight out of the Da Vinci Code, which is the Bengali and the fish, right? The Bengalis have always been very fishy for a long time without reason. First of all, that's a very good question, but I don't think everyone has fathomed the answer yet. A few clues to what can explain the mystery is that, look, most other people, if you look at the say coastal population or islandic population, people who live in islands and take a lot of fish, like the Japanese or the Eskimos up in the north, or the salmon eating population. Now, most of them would almost, apart from us in South Asia, most other people would take their fish without frying or cooking it too much, right? Now, since we in Bengal are experts in supplying oil and giving oil and eating oil as well, it's a part of our culture. Oil is a part of the Bengali DNA in all forms, sizes, and shapes. So where we have gone wrong basically is that we really use too much oil, and in course of which we really spoil the biological, the natural sort of, like the fish oils, a lot of good fatty acids that a fish may have. So the tempering, because cooking is a chemical process. You are heating, you are frying, everything is a chemical process. Now, the thing is that this has become so much a part of our habit and diet that tomorrow, if I start telling all my patients to have boiled fish, I will be completely out of job and totally out of patients. And nobody is going to listen to it. So we need to, like the Japanese, the Japanese for a long time, till they had the American colonization of Japan by MacArthur, had very little cardiovascular disease. Eskimos have very little cardiovascular disease. And many of that is advantage. So what can be a solution? What can be solution is restrict. You cannot cut out the oil completely. So you restrict the amount of oil. So give you a rough idea, say an average family size of 4 people. When they cook, have a kind of standard Bengali meal. You have your oil consumption for about 4 people should be no more than about 3 kgs per month. And then the question comes, what kind of oil? Now we roughly categorize oil into 2 kinds. So one is what we call the white oils, the shada tel, and the other is called mustard oil, right? So shada tel and mustard oil can be used in a ratio. Some people do it half and half. Some people do it 1 part and 4 parts. So a mixed oil usage policy, because there are different kind of saturated and unsaturated fatty acids in this oil. So if you mix them up, you kind of get the best of both the worlds. But that doesn't mean, supposing you have enormous quantities of 2 types of oil, that is not a good thing. So you need to restrict the quantity in the first instance, then use a mixture of the white oils and the mustard oil, and both together should not be, for a family of 4, should not be any more than, say, 3 kilograms a month. And given what the present government is doing to the price of edible oil and the oil you put in the car, I think that will be a very prudent financial move as well. Because very shortly you will run out of money to buy oil. That's the problem.
Okay, sir. One thing also I'd request to elaborate. How about that, since we're talking about mustard oil, that cold pressed, unrefined mustard oil, because I don't know how it is sold in West Bengal. Would you like to add on that also, that comment?
I must confess, I probably don't know the details, but by and large, I think it is a good idea to have the oil as natural as possible. And when people have tried to refine the oils, I think especially with mustard oil, what they have basically done is they have tried to take the sting out of the oil. Because the mustard oil, has that sting because Bengalis usually cry either when they're very sad or when they're cooking fish with mustard oil. Because you really use, you can see it in some of the advertisements these days, that they advertise a good quality oil by saying that, you should be crying when you're cooking, because that is the sting of the oil that goes out and hits you. So I think that is manipulated, but I must confess that I've got to check up on what are the chemical deviations that happens between refined and non-refined. 2 things is, do not depend tremendously on fat substitutes like butter substitutes, etc. They were very fashionable at one time. They are not good at all. So rather, if you want to have a little bit of butter, have a little bit of natural butter. That is much better. Don't go in for the butter substitutes. Anything you want to do it in limited quantities. And some of the, what we call the frozen, the solidified cooking material like dalda, that is not very popular at all. So please don't refrain from that. And I don't think we do it in our houses a lot. But it is usually a very good practice not to refry in oil. You can, but our mothers, our wives, people who do the cooking, nowadays most of the cooking is done by Swiggy. So you have huge kitchens where food is delivered. Not a lot of people cook these days. But people who are expert cook will tell you that there is a combustible point of oil beyond which the oil gets burnt. So never refry in burnt oil. Experienced cooks in the kitchen will tell you that ye tel abhi khatam ho gaya hai. So it is not to be used again. So don't do that, because that is very harmful for the body. It has a lot of toxic stuff called trans fats, etc. So you might use it once or twice. I don't know how many times. I've never cooked it for the last 30 years. But once your oil gets burnt beyond the point of combustion, that is what they do for so-called outside. Say roadside, you are having this tele bhaja and all that. They go on using the same, beginning till the end of the day, they use the same oil. So that is the other problem. So restrict the amount, mix the oils, and no matter whatever, have a good mixture of oils, and with that you should be well and safe. And do not use olive oil for cooking. Olive oil is a very good oil, tremendously expensive. I can't afford it, so I never bought it. So olive oil's main problem is it is an oil used in Mediterranean diet mainly as dressing. Italians and Mediterranean people put unheated oil on the food. If you ever give Italian a piece of fish and ask them to fry it on olive oil, they'll have convulsions. They've never seen it in their life. And olive oil misbehaves chemically if it is fried. So please, you're welcome to have olive oil if you can afford it. If you're not a doctor, you can have it. But never fry anything in olive oil. It's not meant for frying.
Thank you so much. And you really gave wonderful and very interesting tips. And after listening to you, I only envy the people from South France. They can have their pork and wine and still be healthy and not have heart attacks.
Tempting, yeah.
Yes. So now we move on to Dr. Sanjay Mandal, sir. One thing I was noting was that people in West Bengal have a lot of stress. First of all, is it true? And if that's true, does that add on to IBS cases in West Bengal?
Whether West Bengalis or people in West Bengal have stress is something I think I don't have an answer to that. Stress is universally present. How we deal with the stress is probably different. But yes, high levels of stress does predispose one to irritable bowel syndrome. And I think we have enough of it here in West Bengal, definitely. It's clinically shown that people who are very stressed out tend to have more problems with regards to IBS. So our advice to most of these patients is to de-stress, and we, apart from medications, we always advise patients to take a yoga or de-stress out, and this helps in decreasing their IBS disease pattern. Apart from this, but whether the stress contributes to that in West Bengal, I think I really don't have an answer to that. But yeah, probably genetically, I can say that we are probably a bit more unfortunate in that our genetic makeup may predispose us more to non-communicable diseases. And probably what I feel is that in West Bengal, the propensity of exercise, the propensity of daily activity is less. We are more lazy than the rest of India, probably, and that is what predisposes us to more of non-communicable diseases. That would be my take. Yeah.
Okay. Thank you so much. Now I'd like to come to Dr. Sunil Kumar. Dr. Sunil, are you? Do you feel that the dietary practices, especially that we've been discussing, Dr. Sarkar and Dr. Mandal, do they contribute to any particular kidney disease, and especially in West Bengal?
Yes.
Excessive fish, red meat.
I stand for all.
You're
the
muted, I
illnesses,
guess.
all the. Am I audible now?
Yes, you're audible now.
Okay. See, dietary habit or dietary healthy diet or dietary habits, they are very important for all the communicable illnesses,
You're not audible.
including the kidney. And communicable now. Hello.
Yes, yes, you're audible, but now you're again muted.
Now.
Yes,
Can you
yes,
listen?
yes. Please speak.
Okay.
Yes,
Right.
yes,
So
yes,
what
we can.
I was saying that population of Bengal is such that aged population is more as compared to rest of the states. So those above 60s are more in number in Bengal as compared to rest of the country. And communicable disease are such type of illness symptoms in antibiotic or small treatment. They usually tend to accumulate. So this accumulation tend to develop over a period of time and seen commonly in the aged population. That is again one of the common cause of seeing more NCD or non-communicable diseases in Bengal as compared to rest of the India. Regarding your this current question of diet and the kidney, yes, these are very important in all the aspects. One, the common cause of kidney disease is diabetes and hypertension. Again, diabetes and hypertension has a important context in the form of diet, like diet high in calories or high in salt intake, or diets which are packed ultimately affects the kidney. Apart from this, very important dietary factor is the beverage, aerated beverages like cold drinks. These are again very important a source of fructose, which over a period of time gets converted into uric acid, which produce renal stones. Apart from this, long-term high blood sugar tend to make complex sugars which cannot be digested in our body, which will accumulate here, there, everywhere. In the eyes, it will produce cataract and diabetic retinopathy. In the kidney, it will lead to kidney failure. In the liver, it will be seen as liver dysfunction or non-alcoholic fatty liver disease. So in a way, yes, diet is very important. Just one more thing. I am getting call again from my surgeon. We have posted a kidney transplant. So I just finish here by saying one more line, that true definition of health is basically complete physical, mental, and social well-being, not just the absence of disease. So which it includes a good sleep, good diet, absence of disease, and good mind. So this is my final message to everybody, that stay happy and physically active and healthy. You will find the exact definition of all these even everywhere on the Google or Wikipedia. So with doing this, most of the kidney disease can be avoided. In case somebody has developed some kidney disease, then don't hesitate to meet your physician or doctor or nephrologist at the first go, because most of the disease can be halted from progressing in the early stage, but in the late stage, it becomes very difficult for us to intervene also.
Thank you so much. Thank you so much, Dr. Sunil. You really gave a very good overview of the diet and how that affects the kidney and the health in general. Thank you so much for being with us. Thank you so much for sparing time on behalf of ASSOCHAM. I'd like to thank you once again. Dr. Kunal sir, I would like to come over to you, and since we are running out of time, I would request you to give, even though you have given lots of very good advices, I would request you to give a small a message for our audience.
Thank you, Mr. Casey. I was trying to multitask as usual, see a few patients. I think the message basically is that those of us who are privileged enough to be on the right side of the economic fissure or the economic chasm, so as to say, we must adopt a policy, because if you and I start waiting for the time when India is going to have the perfect constitution and the perfect healthcare policy, maybe we have run out of fuel by that time. So I think for the average policy family, it is extremely important for us to take a structured approach to the issue. From say, a family, they have a young child. The child will then go to school, from school to college, from college to, say, profession. At every stage of our life, we need a kind of overall medical vigilance, right? I am, since I'm like a plumber, I repair hearts and things like that. So if there is one fellow who's totally focused on the heart, the other fellow on the liver, the other chap on the kidney, that is going to create a lot of confusion. And that is why we need to revive the old practice of overall holistic general medicine, taking care of the community, whether you're 5 or 75 years of age, appropriate to our time in life, we need to have a kind of vigilance, simple vigilance schedule. From the cardiovascular point of view, a series of blood tests, an echo and an ECG, maybe once a year. And should there be more symptoms, the doctors will tell us there are things like CT scan, angiograms, MRI, all that is later. So a basic vigilance, appropriate for our age and time and place. We all, we are busy with our professions. We work hard. We need a little bit of time for vacation, going around with friends, having a good meal once in a while. So we can have a perfectly normal lifestyle and stay healthy at the same time. And last but not the least, please let us not aggravate any issues. What are the aggravations? The aggravations in my generation and maybe a generation before me used to be smoking tobacco. That was identified with a kind of urban masochism. You have not arrived till you had a faded jeans and a cigarette in your lips. But this day and age, that identity is getting into, cigarettes are there, very much there. You look at the financial health of the companies, you will know they have not gone away anywhere. But at the same time, what the younger generation, the late school, the early college life is still getting used to, along with tobacco, they are still getting used to substance abuse, like drugs, chemicals, etc., etc. I'm not just referring to film stars children, but even children in middle class population. They are susceptible to these things. And whenever we look around, especially in our women folk, in people who work in our household, we must make them aware of oral tobacco abuse. So oral tobacco abuse, you can go on printing the entire Bhagavad Gita on a packet of cigarettes, it does not matter, as long as 70% of India smokes bidi. And bidi is so small that you really have to have a great, lithographer to go on scribbling your big sermons on a bidi, not possible. Similarly, with oral tobacco abuse, oral cancer, it's a bane of India in general, North India in particular. So look, let's live a good life, have periodic vigilance, have good diet, stay healthy, don't aggravate the problem, and do not wait for the first problem to happen. The first chest pain is too late. So if at all we have a problem, we want to get it before that. And the first doctor that you need to see is the doctor who's the nearest to you, your general physician, the person, the trustworthy doctor in your community, because that is exactly from where our healthcare vigilance will start. Stay well, be well. Thank you.
Thank you so much. Just 2 words about alcohol. Do you allow that?
Well, alcohol, I've never allowed myself alcohol because I've never had the money to afford it. So, but as in general is concerned, you see, we do not have the same zero tolerance to alcohol as we have for cigarettes, right? So alcohol, what is defined as social drinking. Now, what is social drinking? I don't know because I've never drank. So go and talk to I think that is, if you look at the information, that is, and I forget, because the British standards used to be in ounces and stuff like that. So maybe a couple of times a week, if you have social drinking, that is not considered. Then alcohol also depends what you are drinking, the concentration of alcohol. But there is, I think, a big issue with people drinking, whether you should drink before food or after food. So never get into the habit of drinking in an empty stomach. That much I know, because all the alcohol is metabolized in the liver. So if you hit the liver hard and the liver has not had the nutrition it needs from your basic diet or food, then that is disastrous for the system. So whatever, even if you drink too much of water, that is not good for you. So everything in moderation, everything in the right quantity, but in the same way, medically speaking, we have zero tolerance for tobacco. Alcohol in limited amounts is permissible. And as Karl Marx said, that the ultimate truth of life is money. So don't overdo alcohol, because if you are down with heart disease, if you have 4 or 5 lakh rupees, you can get a cure. If you are down with liver disease, you'll be struggling with 50 lakhs, right? So it is 10 times more expensive than curing heart disease. So don't do anything that you cannot afford. So that is the way perhaps Karl Marx would have defined preventive medicine. But smoking, zero tolerance for smoking.
Thank you so much. That was really a very, very interesting discourse.
Thank
and
you.
a
Thank
very
you, sir.
important. Thank you so much for being with us. Thank you
Thank
so
you,
much
sir.
for
I'll
sparing
take your
time.
leave and
I'd like to thank you on behalf of ASSOCHAM. Thank you, sir. I'd request Dr. Sanjay Mandal to give a message to our audience. Dr. Mandal, sir, are you there?
Yeah, I am here. You can hear me? Yeah.
Yes, we can hear you, but we can't see you. Yes, now we can see you.
Yeah. I think, in my opinion, for non-communicable diseases, the cause is genes and environment. Genetics is something we cannot change. The environment we can. Well, you can't change the pollution. You can't change what is there, but you can definitely change what you eat and what your lifestyle is. So I think lifestyle and our dietary habits is very important with regards to prevention. And I would like to say that previously there was always, generation before us, there was the problem of lack of food. People would go hungry. But I think in today's generation, the situation has changed. Now we have a problem of the more of food. People are eating too much, they're exercising less. I think our attitude or our aim should be to eat less, exercise more, do things in moderation, as Dr. Sarkar said, avoid the bad habits. That's it. Thank you.
Thank you so much. That is very true. If you can burn it, only then you eat it. Physical activity is very important, as everyone has mentioned. Lifestyle modification is very important, and that probably is cause of majority of the non-communicable disease. Thank you so much, Dr. Sanjay Mandal, for being with us, for sparing your time. I'd like to thank you on behalf of ASSOCHAM India once again. And I'd like to once again thank all our esteemed panelists who devoted so much of time to this webinar and answered all the questions. And they really enlightened our audience and gave us very practical suggestions and practical tips on how to manage our health and how to prevent disease. Thank you and wishing you all the best once again, and happy Navratri. Namaskar.